In this video, I'm going to answer a very common question I get each week on if I treat trigger points in my own practice and if scar tissue is considered a trigger point. I cover the following. What is the true definition of a treatment? What trigger points are and why they form? Why I don't treat trigger points? What is scar tissue and why it forms? And lastly, how to effectively treat scar tissue. For those of you that don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert specifically for neck, shoulder, elbow, and wrist pain. My focus is on finding and fixing scar tissue and then reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning, flexibility, and long lasting pain relief. I'm also the creator of the Peak Method and the founder of the Soft Tissue Treatment Revolution, where we teach self employed and overworked massage therapists a better treatment system that will allow you to cut your treatment times by at least 50% so you can stay healthy, avoid that dreaded burnout, and help a hell of a lot more people get out of pain. So, I like to make these educational videos just to share some knowledge, hopefully, change your perspective on treatment and get you in the realm of understanding that you need to be more of a solutions provider that solves problems, does it better, does it faster than anyone else out there. That's why I share all this information out there to help kind of change your perspective a little bit. So I get a ton of these questions pretty much every week. Whenever I put up a treatment video demonstrating some type of treatment using my system, the Peak Method, and my treatment method called manual scar tissue treatment, a lot of people say, oh, yeah, you're just treating trigger points. That's what I do. Okay. But here's the thing, I'm not actually treating trigger points, and it's a really big difference. A lot of people ask me a lot of questions like, is it the same as scar tissue or adhesion? So that's what I want to cover in this week's educational video. So, first thing we want to talk about before we get into anything is what is the definition of a treatment? A treatment is some form of intervention that aims to remove some form of pathology. Now, in a musculoskeletal injury, and most of us watching this are musculoskeletal providers that use manual therapy, there's only 7 potential problems that we would actually treat or affect with our treatments. It's going to be a problem in the bone, the cartilage, the ligament, the disc, the nerve, the soft tissue, and the tendon. So, those are the potential pathologies that we would treat with our manual methods. And the other component of the treatment is it needs to be safe, effective, and durable. So, basically, not doing a lot of harm. Effective, does it do something? Does it improve range of motion? Does it improve symptoms? Does it improve function? And the last piece is durability. Is it long lasting? Now, a lot of treatment methods and techniques out there are safe and they can be effective in the short term, but they really lack that durability component because they're actually not breaking down one of those above mentioned pathologies in there, which in turn doesn't actually make it a treatment. It's more of like a maintenance type of approach. So let's just start with trigger points. So, a trigger point is basically just a chemical response in the muscle to something going on. Usually, there's something else going on deeper in the pathology, and it's just a chemical response that causes that muscle to get tight and spasm and kind of lock out. If we looked at a trigger point under a microscope, it would look exactly the same as a normal healthy muscle, just has that different chemical response. Now, what's happening with the trigger point is the effect of an issue, it's the effect of an issue, it's not the cause. So, a concept that I learned a long time ago was this idea of protective tension. And a lot of times when there's damage to the nervous system, possibly a nerve entrapment, I've covered that in a lot of videos, or damage to the disc or the cartilage or the bone or the tendon, the muscles around there tighten up to protect that area to unload it because they don't want that problem to get any worse. So a trigger point is really protective tension to take the pressure off of there. The best example I can give of this is when you sprain your ankle, your body knows to limp, to take the pressure off of that area and allow that tissue to heal up. And that's what's happening with the trigger points. It's a chemical response to something else happening. It is not the true cause, it's the effect of that problem. So when you're treating it, it's not actually a treatment. That's what I said before. It has to be safe, effective, and durable in removing a pathology. It isn't a pathology because it isn't actually a physical change in the muscle itself. And when you're just addressing trigger points, yes, you're unloading that tension and that pain and all that feeling of like just locked up in there, but that's happening for a reason. A lot of times it's trying to protect an underlying problem. Sometimes I believe that treating these can actually be dangerous. Like, say someone's got some trigger points, maybe in their trap or like in their shoulder. And what's going on is underneath there might be some damage to the disc in the joint, or there might be some cartilage damage. That trigger point is basically the body's way of just taking and unloading the pressure off of that area. So, say you go in and you address the trigger points and you get them to relax. And then what happened is you actually exposed that area and that degeneration and that problem that's in there as well. And you can actually set that client up for some problems down the road, because now they don't have that pain signal as much anymore. So they think they can do more, but now they go and load that bad tissue and do even more. So you might think in the short term, because they're feeling better and they're moving better, that it's doing something, but it's not. It's not actually durable, and it's actually not safe because you did not address the underlying problem. When is it okay to address these? I guess like in between treatments, when if the client's just really beat up and really jammed up and they just want some symptom relief so they can just relax and kind of chill out. Like, maybe they're just so locked up, they're having so much pain, they can't sleep, they can't focus. You can go in there and work on some trigger points, let it chill out, but let them know, hey, I'm going to do this. I'm going to release some of these trigger points, but what I need you to do is just go home and take it easy. I just need you to relax, lay down, get some ice on it, go for a walk, don't do anything. A lot of times people treat these clients and they treat their trigger points, and then the client feels great. So they think they can go back to their destructive activities and beat their body up more. And then they end up having a bigger problem all over again. And then they're back in there again, getting the trigger points worked on, and it keeps coming back. And you're not getting any real results. And you're trying to figure out what's going on. What's happening is you miss that critical thinking component of what's really going on deeper in there, that there's a problem in the bone and the cartilage and the disc and the ligament. There possibly is a nerve entrapment. There's scar tissue that formed. There could be an issue with the tendon. And knowing all the aspects of the treatment and what it's presenting with can not only help you treat it better, but can also help manage the load in between treatments so the client can get optimal results. So, scar tissue, also known as adhesion. I have a photo over here of what scar tissue looks like under a microscope. So, first thing is, why does it form? So, scar tissue forms in a few reasons. A lot of when I get my own clients that reach out to me, they're like, how did I get scar tissue? I didn't actually have an accident. Now I say that's a great question. So 10% of the time, it comes from trauma, accident, a really high load environment. But the other time is just from sustained and constant contraction. We spend too much time sitting down. We don't move enough. We're in bad postures. We're doing all this stuff. When this happens, the muscle doesn't get enough blood flow, doesn't get enough oxygen. What it does is it sends a signal to the brain and creates this thing called hypoxia, where there's limited oxygen. So the brain starts to think that there's a problem there. So it starts pumping out all these collagen fibers, but they end up being very immature. And then they build up in the muscle, and they're not as good as they're supposed to be. So now you get even less blood flow. You get decreased flexibility, you get weakness, and you get a lot of pain. Now, the scar tissue itself is a physical change. It looks different when we look at it under a microscope. Whereas when we look at a trigger point, as I said earlier, it looks exactly the same as a muscle. This is actually a physical change in the muscle and produces actual real physical changes as well. And then also we'll get some chemical changes in there because there's increased inflammation and there's less blood flow. So there's going to be a chemical response as well. Usually the first cause of an injury starts in the soft tissue components of the muscles, the fascia, the ligaments, and then eventually the nerve entrapments as well. So a lot of people will say, oh, well, I can't treat bone, I can't treat cartilage, I can't treat disc, I can't treat tendon because it's not in my scope of practice. That's for other people. But yeah, a lot of that degeneration happened because these other things are forming and that scar tissue is forming. I always say, think of the degeneration as someone's thumb and it's stuck inside a car door. The car door is all of that scar tissue. We need to remove that to give this a chance to heal up. So scar tissue is a real change in the tissue. Trigger points are not. So effective scar tissue treatment. First, we want to start with an advanced and focused palpation. So many people just want to treat the entire muscle. What I teach is a very detailed and focused functional evaluation where we look at range of motion, we take a thorough history. And when there's scar tissue present, what happens is the muscle has decreased compressibility. You really can't sink in. With a trigger point, you can sink in. It's tender, but you can sink in. It still has like pliability in the muscle, where scar tissue just feels like a wad of chewed up bubble gum, feels like a brick wall. So once we find that area, what we want to do is put the muscle in a shortened position. That shortens it up. Then we want to go just a little bit inferior to that palpable adhesion. Then we want to get proper depth into that area. Then we want to back out about 10%. Then we want to set tension into that area. And then we want to pause. And then we have the client go through a full range of motion, and we're allowing that tissue to slide underneath us as we're creating tension in there. A lot of people will be like, oh, is this cross friction massage? No, it's not. Cross friction massage is you treat the whole muscle. We're treating the one area where that scar tissue is, which is going to have the most dramatic effect in overall functioning of the tissue. You want to get that full range of motion and letting it slide. A lot of times what I see is people are too compressive. The tissue doesn't slide. You feel a lot of tension generating, but it hurts like hell to the client. And the client thinks because it hurts like hell, you must be doing something. You're working really deep and you're being focused. All you're doing is jamming that scar tissue even more and just pissing it off. You can treat it with an instrument, and you can also treat it manual. I don't think there's any other way to really treat it effectively to get those components of depth and tension. I use an instrument maybe about 10 or 15% of the time, mostly in like the ligaments and more superficial tissue. Most of the time, I'm using my hands because I am a manual therapist. Your elbow will not work for this because you're not going to get the tension component. So when I see people just jamming their elbow into people and rubbing it, or even having them go through a full range of motion, all you're doing is getting depth. You're getting no tension. Cupping sure as hell won't work either because you're not creating that tension component. I've seen cupping where they put the cupping on and have the client go through a range of motion. You're still missing that component. You're getting the depth, but you're not getting the actual tension. Stretching certainly won't work either because you're not getting the depth and tension on that area. And the problem with traditional myofascial release is it's too compressive. It doesn't account for the tissue slide and proper tension. So what I find is a lot of people that are doing myofascial release, they're really just jamming on the tissue and it's not doing anything. Other people will call it pin and stretch. You're not pinning it down. Stretching isn't getting it either. You want to get proper depth, tension, and then have that tissue slide. I always give the example of like a rubber band. If I had a rubber band and I needed to break it, I could put it on the ground, I could jump on it, I could drive it over with a car, I could stomp on it. It's not going to break down. What breaks it down is tension and getting that pull in there. And a lot of these other so-called treatments say they're addressing scar tissue, but they're really not. The attention to detail, the focus and the right feel, and then every once in a while you'll get some of those providers out there, specifically like physical therapists, that'll say it's impossible to treat scar tissue and adhesion. You need superhuman strength. They always go back to one study that was like done with like fascia in the foot, but don't account for the rest of the body, that it's different from where it is. They're just saying that because they suck at manual treatment. Manual treatment is the most effective, safest, and best option that your clients have to restore range of motion, flexibility, and create long-lasting pain relief. So that's all I got for you guys. Do me a solid and help spread this material. You could share any insights you might have gotten in the comment section below. Share it with other providers that you know that it might help. And lastly, go download our free training modules. The links are wherever you're consuming this. I appreciate you guys watching, and I'll see you on the next one. Bye.